All right, this last set of slides, real quick, are just common hip and thigh injuries that you might see, whether coaching, whether you're, sports medicine, PT, OT, athletic training, any of those things. These are very, very common injuries. So we're going to go through these. The book has more information that can help fill out, but again, just what I want you to do, recognize kind of the key red flags or big complaints that somebody might have, and then what we do to fix it. All right, so just kind of main ideas. First of all, meniscus tears. Your meniscus are your shock absorbers. So you've got a medial and lateral meniscus that sit on top of your tibia. They just help prevent bone on bone. They're thick chunks of cartilage. And over time, they get worn down. You can see over here, there's lots of different types of tears. There's a wide variety of types, but just be aware, any tear is when a part comes off, a part kind of tears away, peels up. Someone with a meniscus tear will complain of clicking or catching. Okay, so clicking or catching with a meniscus tear. They might have pain with a squat, pain going up or down stairs, pain with sitting for a long time. But what happens is this little chunk starts to wear away. It flakes off and it becomes torn, or it gets caught, and then it gets caught between the femur and the tibia. Okay, that's what gives you that clicking, that catching. And over time, if we don't do anything with a meniscus tear, we're going to have to fix it. And if you don't fix it, it will lead to arthritis. Okay, it will lead to early arthritis, bone-on-bone contact, which we absolutely don't want. Meniscus tears have to be fixed surgically. All right, so meniscus tear, they'll go in, they'll either cut away a section or they'll sew it back down, but essentially that meniscus has to be fixed surgically, and it's probably going to take anywhere from 6 to 8 weeks. All right, so you're looking at 6 to 8 weeks for repair. IT band friction. Remember, as we talked, when your knee moves from flexion to extension, okay, that IT band rolls over that lateral condyle. It causes pain. Somebody with IT band syndrome, this is an overuse injury. All right, we have overuse. So too much rubbing, too much friction back and forth causes pain. Somebody with IT band is just going to have this big, wide area of pain on the outside of their knee. It might snap. It might kind of catch at times. You might even kind of feel this little bit of a pop. But basically how we treat it, we want to stretch that TFL, stretch the glutes, and we want to try and modify. So if you're a runner, maybe ride the bike or elliptical for a while. We look at cross training. All right, so IT band is overuse. Now, we're getting into ligament tears. All right, the number one ligament tear that we see far and away is with the ACL. All right, so the ACL is going to be our primary ligament that is torn. We break that up into either contact or non-contact. Here we have contact, getting hit and your knee buckles one way, or we have non-contact. All right, with non-contact, typically we see some sort of twisting. All right, so some sort of twisting force. Non-contact we can think of like landing after a jump. Contact are about 30%. Non-contact is about 70%. So we see twice as many, or more than twice as many, non-contact ACL tears. Now, here's the other thing with ACL tears it's important to realize. Women are 2 to 6 times more likely to tear their ACL than a man. All right? Women are 2 to 6 times more likely to tear their ACL. There's a lot of different reasons for that. The main kind of theory that we have, we look at the hip to knee angle. Okay, remember with the pelvis, it's going to be wider with a female. So we have a wider pelvis, typically more narrow knees. That puts more stress. All right, so females are 2 to 6 times more likely to tear their ACLs. That's why it's important we do proper strength and conditioning. We do some ACL prehabilitation. We try and strengthen the quads, strengthen the hamstrings, strengthen that control of the knee so we don't have tears, regardless of if it's a male or female. But if you're coaching a female sport, you need to keep that in mind. That might be something you want to look into. What happens with an ACL tear? All right, we have some sort of twisting. We have some sort of excess movement. whether it's a partial, complete, or a full rupture, once that ACL is damaged, it is not going to heal on its own. Okay? Someone with an ACL tear will complain of looseness or laxity in their knee. Their knee gives out. Okay? Immediately after, they'll have rapid swelling. Okay? The knee balloons up. They might feel a pop or hear a pop. They might not. It might be painful. It might not. But the big thing you're going to see for sure with an ACL tear is swelling. Okay? Lots of swelling. Now, ACL tear has to be fixed surgically. All right? Has to be fixed surgically. Have to go in. They repair this. What they do is they remove the old ACL and they will use a tendon, typically some of your hamstring tendon or a part of your patella tendon, and they go in and they use that new tendon to become a ligament. All right, so they'll drill through, they'll create a new ACL, it will be stronger, it will be just as good as your old ACL, but it's going to take anywhere from 6 to 9 months. Okay, so ACL has to be fixed surgically, 6 to 9 months. With contact injuries, as you can see, often with contact, we're going to have multiple ligament tears. It's very common that when we have a contact injury, you're going to see an ACL and an MCL, or an ACL, an LCL, and a meniscus, or a combination. All right. Contact injuries are incredibly violent and are incredibly violent on the knees and are going to cause lots of damage. The good news is, if for this rugby player there is good news, whether it's an ACL or an ACL MCL, ACL LCL, any of those combination, you're still going to be within that 6 to 9 month recovery window. Okay. Now, one of the main injuries you're probably going to see, some of you probably suffer from this, is PFS, Patellofemoral Syndrome. Okay? PFS is the #1 cause of knee pain. We want to think of our patella like it's on railroad tracks. Okay? Railroad tracks work really well, straight up forward. Okay? No curves, straight ahead. No curves, no quick changes. We want that patella to track up and down in a straight line. Someone with PFS, that patella will get pulled to the side. Almost 99% of cases, the patella will go laterally. All right, most of us, our vastus lateralis is stronger than vastus medialis, and so it's going to pull that patella laterally. What happens is as that patella gets pulled laterally, it starts to rub. So rather than sitting in that groove, it starts to rub and you get swelling, you get pain. That underside of the patella becomes irritated and it just always aches. Okay, someone with PFS is going to have achiness. They can still move, they can still do everything they want, but the knee just hurts. Okay, activity increases the pain. So the more active they are, the more pain they will have. With PFS, we want to stretch what is tight and strengthen what is weak. All right, so our fix, stretch what is tight, strengthen what is weak. We can also see these different bands, these different types of devices. The goal is to just get that patella to track straight up and down rather than side to side. We do not want side to side, we want straight up and down. Most PFS rehab involves quad strengthening. Okay? 2 more injuries. #1, Piriformis Syndrome. This is just tightness. All right, what we see is the piriformis can get tight and it puts pressure on your sciatic nerve. So someone who runs or cyclists, this piriformis is very common to get tight. It puts pressure. And someone with Piriformis Syndrome, we call this dead leg, where their leg just goes numb. So they might be sitting in class, they might be driving, they might be at work, they might be working out, they might be riding a bike. But as that piriformis gets tight, it puts pressure on that nerve and just causes your foot to fall asleep. So if you have a foot and your toes, one side over the other, that just always feels like kind of numb and tingle or like pins and needles, it's probably tight piriformis. Easy fix, we stretch. Okay? There's a lot of different piriformis stretches. YouTube has a great list of piriformis stretches. A good thing I like to do is take a tennis ball and you just kind of sit on that ball or sit on the foam roller and find that area of tight under your glutes, and you just want to put pressure right on that piriformis, and it helps loosen that muscle up. Lastly, and I hope that you never see any of these in your career, but a femur fracture. High velocity falls, high velocity impacts. Like we talked about, the femur is incredibly strong, but it can, just like any other bone, it can break. These two pictures on the left, this was actually a former student of mine that I had several years ago that broke his femur. This was somebody that fell out of a 3-story building. You can see the different parts. What I want you to get out of this, look at the hardware, okay? Massive amounts of hardware that's involved. This person had a femoral neck fracture. But what they do with a femur fracture, they'll try and put all the pieces back together. They'll line everything back up. Then they take a big drill bit and they drill all the way through that femur. Okay? So they drill top to bottom. They take a metal rod and they hammer that metal rod down through, align the bone, and they'll put screws. Okay, so here you can see multiple screws going through, but they're trying to reproduce that femur and they give it strength through the metal rod. So a very invasive surgery. Probably plan on about 6 months following. All right, and with elderly patients who we see falls with typically femoral neck or even femoral shaft fractures, that can last much longer. So femur fractures, very significant injury. All right, that's it for injuries. Again, just be able to recognize kind of main idea, big ideas, what somebody would complain of, and we'll go from there. All right, take care. We'll talk to you soon.